I believe Michelle has started the recording again now, so we're being recorded again. I hope everybody's content with that. And with that, I will hand over to Anna, who's going to give us some information on community resilience and whether we can reciprocate successful models across different areas. So over to you, Anna.
Okay, I'm going to I'm just sharing my screen. Can everybody see that? Can you see the full slide?
Yeah, it's just hang on, Anna. Here it's taking a minute. Right, it's come up now. Yeah.
Can you see the full presentation or the speaker slide? I'm just checking.
We've got just one slide.
Okay.
Yeah.
Okay. So what often happens in these events, isn't it? And Jack will support this, is that we are so enthusiastic and keen to promote everybody else's work, we forget to tell you all about the work that we've been doing ourselves in Rural Health and Care Wales. So today we finished the Cardi Care project last year, and that's generated a lot of interest. So we decided that it would be a good opportunity to use this webinar to tell you about what we've been doing in Aberporth. I'm head of Rural Health and Care Wales. A quick reminder that Rural Health and Care Wales is a collaboration between the 3 health boards covering Mid Wales. So even though we're hosted by Hywel Dda, and you'll see my background has Hywel Dda badged all over me, I actually work for the three health boards covering Mid Wales, and we do a lot of work undertaking some research and piloting innovative ways of delivering health and care in rural areas, particularly in the Mid Wales region. Can I just ask, I can hear some feedback, if people can make sure that their microphones are off just for now, please. So and first of all, even though this presentation is on Cardi Care, and I can see Molly there, familiar face, we're going to actually just start by mentioning Solva Care. So you can correct me at the end if I mention anything that's not quite correct, Molly. So the Solva Care was set up in 2015. It's now a registered charity, and it was very much a bottom-up approach. I remember I've spoken to Molly and other of the ladies who were the founders there in Solva of this fantastic initiative, and it was driven from the community, as opposed to the project that we did in Aberporth based on Solva. We tried to make it as less top down as possible, but because we were leading on it, it is obviously something that we initiated as opposed to the community. However, community support was hugely important to ensure that we ran the project there in the first place. So if anybody has heard of Solva Care, it is basically, there is a coordinator appointed in the village who manages a team of volunteers who provide support to vulnerable people living in the community to enable them to stay at home as long as possible and to improve their own well-being through organising social events and activities throughout the year. So it aims to build and sustain a vibrant, strong and connected community. It works with the community council, local groups and organisations, and the satisfaction records that they have are extremely high. We've quoted that 81% there. Their aim is to improve health and well-being. I think I've mentioned most of this, and I'll talk a lot more about loneliness later on. But the activities they do and the way that they arrange their volunteers, a big part of that is to counteract loneliness and isolation and social disadvantage. And all of those have been exacerbated as a result of COVID, as I'm sure you'll all appreciate. So the type of activities that Solva would do are listed there. And when I come to talk about Cardi Care, which is the main focus of this presentation today, you'll see that what we were trying to do was to emulate what they did so successfully, or they're doing so successfully down in Solva. And in doing this, and it was recognised as a model of best practice in community care, they developed a toolkit. And there was a lot of scepticism about this toolkit. I remember 4 or 5 years ago when I was working with some people from Solva, there was a lot of people saying, well, you know, that toolkit isn't going to work anywhere else. And my question was, well, why not? you know, surely there must be something in it that other people or other communities could pick up and successfully use to help them get started. So this toolkit, I think this probably outlines, I always like this graphic, Molly. There is a link there if anybody wanted to see it. It's, I think it's 9 chapters and explains how they went about setting up the Solva Care model and how other communities could learn from what they've done and benefit, I suppose. It gives communities confidence to know there's somewhere to turn if they wanted some guidance, even on basic things like insurances, which I found quite useful. So that's Solva Care, and we, because we were basing Cardi Care on the Solva Care model, we asked some of the people working in Solva Care to very kindly be mentors on our project. And here we go. We've got Molly, who's here with us today, Sue Denman, Jessie Buchanan and Lena Dixon, who is the appointed coordinator, and they sat on our Cardi Care steering group and were invaluable in taking our project forward. So Cardi Care, and this is it in a nutshell. I know that's a really long sentence. I'll read it out to you. It was a pilot project that aimed to investigate whether the toolkit developed by Solva Care community model was able to be used by other rural communities as a basis of emulating and duplicating the successful community care model that is currently in place in Solva and Pembrokeshire. That's what we were trying to do, basically. And why were we trying to do this? And several reasons, but a big driving factor, it was meeting the aims of a healthier Wales, which was the Welsh Government's strategy that was pushing to have health and care more embedded in community settings and taking it away from the primary and secondary sites, and to work closer with third sector organisations and to take a more holistic approach to individuals' health and care, I suppose. So it's inclusive of the social determinants of health and the impact that has on people's health in the longer term. We had worked with Solva Care in other projects in the past and were quite impressed with the work they were doing down there. The toolkit, like I said, had already been developed, but there was no evidence to show whether it would work or not. And what the intention was in developing this project, that we would pilot it in Ceredigion, but then we had the intention of rolling it out to other communities. And people have asked, why did you choose Ceredigion? And it was for the simple reason that we found grant funding that would enable us to run this project for a project that was based in Ceredigion. And because we are hosted by Solva and we're actually sited in Ceredigion, we're sometimes restricted to grant funding where we operate. So the main aims of the project was to support and sustain vibrant, strong and connected communities, to offer support to individuals in need in the community, to establish and coordinate a group of volunteers to support people in need, to organise events in the community and to encourage socialisation, and all that on the back of trialling the toolkit that was developed by Solva Care to see if it could be emulated in other communities in Wales. And at the end of the project, we very much didn't want to be an intervention that dipped in and dipped out. If it was successful, we wanted to ensure that the project was sustainable and that there would be funding available for it to continue after we withdrew from the research. We developed a number of publications and projects that would tell people what the project is, and this is one of the leaflets. It was produced bilingually. I think throughout this you will have to see, because we were grant funded, we were obliged to include the logos and to recognise that funding. So we simplified it to, you know, the aim to build and sustain a vibrant, strong and connected community. And I think as the project went on, we realised we're not really building it because a lot of these communities are already strong and vibrant. What we were trying to do was to support it. So, you know, in hindsight, looking back, there's some of these that we might change the wording on. And the benefits then would be to the residents of the community to try to support them to stay as long as possible in their own homes and to benefit from the socialisation that living in a vibrant community could bring. And then the way that we were going to do that was through using volunteers. That's just another one that simplifies what the prime aims were. So the first step that we had to do was to choose a community to run the research. And because we were trying to negate as many as possible, no research is pure, as I'm sure you'd understand, particularly when it involves, it's quite complex and it involves multiple partners. So we were trying to negate as much external influences as possible by choosing a community as similar as possible to Solva. And the demographics that we were looking at, these are the Solva's demographics. They have a population of around 800, very small community, small by the seaside, very heavily reliant on tourism, a high proportion of older people, which is commonplace, I realise, across vast areas of rural areas, but more significantly so in coastal areas where people do tend to go on holidays and have an idyllic opinion of, and then a lot of people do move into the area. So we did a demographic analysis of all the villages and towns in Ceredigion. We came up with 4 that kind of matched. And to anybody who knows Ceredigion, you recognise these places. There's Aberporth, Llangrannog, New Quay and Vorth. So they were the 4 that we worked with. Once we'd identified these, and we do realise that the population of these were a lot larger than Solva, and there were other discrepancies, but they were as close as we could get, if you like. After identifying these, we did do a survey then with the communities in each, because as I mentioned previously, community engagement is key. So there had to be a good level of support from the ground up. Otherwise, there was no point in enforcing a project that the community didn't want or didn't feel they needed. And we were going to follow the toolkit model chapter by chapter and look at the advice given and then do our own modifications and then feedback. So it would be a loop, a learning loop. The intention was it would be a 17-month project, that we would appoint a Cardi Care coordinator for 12 months to undertake what Lena was doing in Solva, that we would work with a team of volunteers and to deliver the services, and that we would undertake research throughout on how effective the toolkit was. You know, were the instructions given of use? Was it beneficial? Could it be emulated? And at the end, we were going to the end conclusion would be, is there potential for other communities to use that toolkit to take it forward and copy what they did in Solva or a similar model? That's my funding slide that I think I've been through. So it was leader funded, which was European funds. The grant came from Ceredigion County Council through the Cynnal Cardi project. So I don't think Maleri's with us here, but she's sat on our steering group as well and has been actively involved in a lot of the events that we've been undertaking. So they've been, even though they're the funders and you kind of think of funders are regulatory, but they've actually been very supportive and useful throughout. So we have to mention that. Now, I know this slide is too small probably for you to read, but what I wanted to show you was the original project plan that was developed and approved and where we're going to run it. So it started in November 2019 and it was to be completed in March 2021. And that's what happened. So basically, we had to rip it all up after it was approved, which there was some delays in approval and signing. We weren't in a position to start in 2019. We were in a position to start in the beginning of 2020, and you all know what happened then. So it was ripping up the project plan and starting again. COVID happened, and because this was very much a community-based project, we were unable to encourage people to congregate and to mingle and to socialise. And as a result, we reprofiled the project and didn't actually appoint the coordinator until August 2021. Lake Morgan was appointed then, but for a fixed term 12-month project because the project itself had restrictions on how long its grants could be rolled out. So Lake was appointed for 12 months, and then at the end of her appointment, Nicola King, who was acting as the Aberporth Community Hall facilitator, she then took on the role. And continues to do so, I'm pleased to announce. And we've had the project extended eventually after a couple of reprofiling into the end of October last year in terms of the active research. The only element then was writing up the findings, which I'm presenting to you today, an overview. So the outputs that we were looking for, in addition to trialling the toolkit, we wanted to support one community in Ceredigion to pilot the toolkit and to create its own community care model, to support at least 30 individuals. So we were quite, we had quite low targets, but we were, you know, the main emphasis was on this toolkit. So we wanted to put in targets, specific targets that were attainable, that to create one Cardi Care coordinator role. And like I said, it was a fixed term appointment through the grant funding, but we hope that we would continue afterwards. To try to attract at least 15 volunteers from the community to provide support to vulnerable people, and then to produce a final report that could be circulated and published that would enable other communities to decide whether the Solva Care toolkit would be a useful tool if they wanted to duplicate a similar type of system within the community. So this is obviously just all in a nutshell of what we did. We established a steering group, which was a fantastic group of people, cross-sectoral, and I'll go into that in more detail, who provided a lot of support and motivation to Shaky and myself and others working on the project. So that was key. We selected one of the communities from the 4 identified communities. What we did, we connect all the communities that were identified. We contacted the community groups and we did online and paper questionnaires to ascertain was there any motivation within the community. And Aberporth came out quite highly from the scoring perspective. I won't go through the full results because there was a lot of disappointed communities. All the 4 communities wanted the project to be run there, which is quite positive. And I'm sure there is scope, and there's other work going on in New Quay now, and I know there's scope that through Carvel that they were keen on getting involved with some initiatives in Llangrannog as well, and I know there's a lot going on in both as well. Just goes to show that communities are very proactive and keen to support their residents. Generally, in community groups, there's a plethora of them in all of the 4 places that we investigated. So yeah, the questionnaire was analysed. Aberporth was selected. We'd appointed a Cardi Care coordinator prior to us doing that scoping exercise. And then one of the first roles that Shaky did was to survey the residents of Aberporth, and I'll go into that in more detail. And out of that survey, 19 volunteers were identified who were keen to participate in the project. And so we initially set up the coffee mornings as a weekly event, and we also set up a series of social events. And a couple of other things we did. We did a return trip to and from Solva with people from Aberporth going down to Solva and vice versa. And they were key days as well, which I'll talk about more in a minute. So again, I apologise, this is so small. I'm just showing you, I just really did want to mention the steering group because they were so helpful in guiding the project and how best to move it forward. And the steering group itself, one of the recommendations at the end will emphasise the need to have, I suppose, cross-sectoral representation within community settings because everybody knows a lot. But a lot of people don't know what the other people know. And it's just getting people, as you all probably aware, like-minded people who are all enthused for the same goal to work together. It's a fantastic thing to see. And we had our 4 mentors involved on this group as well. And their input was much valued. So we had some people like the local reverend, the headmaster, the man who ran the chemist, which was the fulcrum of the village where everybody went to the chemist for the local news. Somebody from the pub, there was 1 pub, 1 chemist, and people from the village hall. They had the cycling and fitness classes, and they had masses of things going on in the hall, included a second-hand clothes place. They had a community fridge. And bringing all these people together really facilitated us, helped us, because none of us lived in Aberporth either, to hit the ground running. So we started off with the coffee mornings, and they commenced in April last year. We've done a scoring. They weren't evaluated as strongly as the events because these were drop in and drop out. But we had between 6 and 30 people attended in any one coffee morning. The average per session was 10, but for the time period that we ran the coffee mornings, which is from April to October, there were 189 registered attendees. Now we're still drilling down because sometimes we only got a first name onto exactly how many individuals that relates to, but at the moment the figure is in excess of 50 different individuals attending the coffee mornings. And what we tried to do as well was to integrate more into the community. So other groups like, we've mentioned Merched y Wawr, but we also had school children coming over on one occasion, and they sang, and then
I don't know if you can hear me, Anna, but we've lost sound.
I think we've lost Anna temporarily. Try and get her back.
I think I got thrown out of the meeting, sorry. Can you hear me now?
Yes.
We've got you
Suddenly
back,
threw me
Anna.
out.
Yeah.
Oh, I'll try that again then. I don't know, how far
Yeah.
did you get?
You'd just
Looks
gone
like-
through the steering group membership, Anna, when we lost
Oh,
you.
okay. Bear with me a
It's like
second then.
23.
Apologies
Nothing.
for that. I don't know what happened.
Nothing like that question to check the chairman was paying attention, eh?
Oh. Can you all see that now?
Yes, thank you.
Yeah.
I think I was mentioning
You've
the
done. Yeah.
the
You've told us-
intergenerational aspect, was I?
Yeah, you were just starting on intergenerational when we lost you.
Okay.
Yeah.
Yeah. So they were school children who attended, and they've continued to encourage. We try to encourage the intergenerational aspect, and I know over Christmas that these children were visiting the homes of people living alone to do some carol singing, and they also had some gift packs with them. So I know that's continued. The other really popular aspect that was undertaken was the social events, the social afternoons, and we did visit Solva and attend some of theirs initially to see how they were run. So these commenced in May. So we started the coffee mornings in April and then the social events in May. They were run in an afternoon between 2 to 4. And then the community managed to get another pot of funding to do a luncheon club. And towards the end of our project, they would often invite people for the lunch who'd stay on for the social event. So that worked out well. Various activities. There was a lot of bingo and different games, board games. One of the most popular events was the ukulele band. I think we had 2 different ukulele bands, and I know Solva themselves had a fantastic ukulele band, which gave the Aberporth the idea in the first place. A lot of arts and crafts sessions, weaving, pebble painting, wood turning. There was chair yoga, and Mind from Ceredigion as well did some lovely sessions on mindfulness. which was well received. So there were refreshments supplied. We did 24 events between May and the end of October with an average attendance of 8 people. On one occasion, I think it was in August when they decided then to close for the next 2 weeks. There were only 2, but we've had up to 28 at an event, which is very busy for a little village like Aberporth. And in total, just under 200 people attended. These are just shown. We did try to evaluate the social events and we wanted to keep it simple. So these were the evaluation forms that we developed just to show, you know, how were you feeling when you first came? Was there any improvement in a person's mood? And they proved quite popular or quite easy for them to fill. We had some comments. They were available in English or Welsh. And I think some of the feedback is listed here. And a lot of the feedback related to that socialisation aspect. So the feedback we received from the coffee morning and the events were that it was overall very positive. To provide accessible, and that included sometimes people being picked up, and there was a community minibus that could pick up people as well. The power of social events should not be underestimated. They're very simple to run, but you don't need a lot. All you need is a reason to bring people together. Nearly all the forms witnessed an improved well-being. I think a couple, they stayed the same, but none showed detrimental effect on how people felt when they left the session. And yeah, just to point out that loneliness and isolation is a huge factor, even in a community such as Aberporth, where you think it's a very close-knit and everybody knows everybody. It isn't. And one of the comments I've just put down there came from one of the evaluation forms. Please remember there are a lot of lonely people and those who are too reserved to make the first move, that there may be people in your community that just need that little nudge or that a helping hand to take them through the door for that first time. I've got to mention this. I don't know, Molly, if you're in this picture, but this was the trip that we took down from Aberporth down to Solva in June. We did 2. So there was a group of people and they used the community minibus, went down to Solva in June, and then in July, people from Solva reciprocated and came to visit Aberporth. Very well attended, and it was great to feel the buzz in the room where everybody was getting together and people making contact. We had a lot of feedback that was saying, oh, they loved being taken out on an outing and, you know, could we do more outings? And one of the recommendations I'll come to at the end was that, you know, there should be a form of twinning or mentoring, as there is sometimes with towns and overseas or towns in other countries. We can twin within Wales, we can twin within our own country and benefit from that linking with another community. People learn from each other, good and bad, and making friends and connections never gets tired. Just some of the outputs that we delivered. We did develop a calendar, but we found this quickly changed. So because there was so much going on in Aberporth, we worked with other community events. It looks small here, and I know you can't read it, but it was an A3 large poster that people were putting on the wall. They were quite popular. We also did these postcards, sorry they're a bit blurry, that we used to communicate, because we found with the elderly people, they preferred a postcard being popped through the door than an email or a text, or maybe a phone call as well. So these are postcards that we've redeveloped and are being used quite significantly in the village, just to keep in contact. Then I just wanted to touch on, I'm aware that my time's kind of flying now, the resident survey that we did, and that was back in November, December 2021. So we did 400 copies, paper and electronic, and then we made sure that it was easy for people to post these or to take their responses centrally. So there were collection boxes in the chemist, in the shop, in the pub, in the hall, in various points, in the school even, and in the church. So 63 responses were received, 33 online and 30 hard copy. You can see all the online ones were in the English language, 30 of the hard copy, nearly half were Welsh, and that's one significant difference between Solva and Aberporth, that there was a high proportion of residents in Aberporth that were Welsh speaking, and that wasn't mirrored in Solva. Not that it made any difference overall, other than we had to ensure that both languages were included. So the majority of responses were from residents, of the town, so that's 92, which is what we wanted. They were mainly in the age group 60 to 79 years old, 46% of them were, and mainly, in fact, predominantly female, so 81% were female. 63% had no long-standing illnesses. 25%, so nearly a quarter of respondents lived alone. And on top of that, another 38% lived in a household of two. And it often was the case that they were a carer for the other person. And out of the responses received, 22%, so just over a fifth, asked for support. And the support that people were asking for wasn't so much the practical shopping, picking a prescription, it was more on the socialisation. There was the minor repairs and maintenance, but coming a close second was companionship, dog walking. And what we found is people we had one lady who just wanted somebody to go and play cards with her or have a cup of tea once a week, just to see somebody. So there were the practical interventions that were requested, but there were also the socialisation. We had referrals then from individuals who were looking for support from a range of people. And I think this was another difference between what we were doing between Cardi Care and Solva Care, because Solva Care was a third sector and we were hosted by the Health Board. And I think the statutory services felt more confident in doing the referrals because of the setup. So we had 14 specific referrals for additional one-to-one support. But then we hit a big barrier, and this was the volunteer process. We looked at different volunteer processes that other agencies were using, and the Solva Care one, and the Red Cross, and even Aberporth Village Hall, which has a gold star for its volunteer system. But we were told categorically that as we were hosted by the Health Board, we had to follow the volunteer induction process that the Health Board had. So with the 19 volunteers, one did pull out due to ill health, so it came down to 18. We had 2 induction events, and then we went through the whole induction process. And the future workforce staff from Hywel were very good and attended some of the events with us, and were willing to take the volunteers through the process of becoming a volunteer that will be registered with the Health Board, but based in the community in Aberporth. And then what we found was that a lot of the volunteers lost interest, refused to give the information that was requested, took umbrage at being asked to jump through hoops. And out of those initial 19, with one dropping up to 18, only 2 volunteers actually succeeded in coming on board, and that was not until October 2022. So you can just see how onerous the whole process was. So in terms of the one-to-one support, we were only able to start delivering that in October. We were asked by the steering group to look at wellbeing impact of volunteering, but we managed to do it on the 2 volunteers. We did have to do risk assessments on people's homes that they were visiting. The 2 obviously were in demand. They delivered weekly support, probably more than they wanted to give, because they could, at the point of registering, could say how much time they wanted to commit to the project. And therefore the data that we were able to collect on this element of the research was minimal, and we've decided, you know, we will park it, we will state what we've done, but it's inconclusive. So what we were able to do was to assess the volunteer process and also the process of referrals, particularly, you know, speaking to the Solva mentors, how they're keen to learn more from how we were able to get the statutory services involved. So now we're coming on to the crux of it, which was the main research findings. And the main research findings is that even in what you deem to be a close-knit community such as Aberporth, there is still a need for more community type interventions. Loneliness is a huge issue. I've just put in a couple of comments there. One of the gentlemen who was having support, he'd lived alone for 3 years. His wife had passed away. He was a retired professional, and he did not socialise. He felt out on a limb, and he was really grateful to have somebody who would come and talk with him. And then there was another lady who lived alone, and nobody in the village, in the community groups or the volunteers, this lady was taken to some of the social events. They didn't know she existed. And the lady said herself, you know, does this mean now that people know that I exist? Which I thought was quite poignant. And it made the project very much worthwhile doing. In terms of the grant targets and our own personal targets, we have exceeded, except for the volunteer one that I've just mentioned. We have obviously encountered several obstacles and difficulties along the way. It hasn't been a simple, straightforward path to the end. It's involved lots of twists and turns. One of the key findings has been that statutory services volunteer recruitment systems are not compatible with community initiatives. And if the Welsh Government drive to embed more health and care responsibility, or the drive for that is more community based, then that's going to have to be re-looked at. And we've got a lot of interest from health boards and other statutory bodies who are taking this forward. So that has been a really positive outcome, I hope. It was the first time that Hywel Dda ever had to work with with volunteers based in a community setting. And I also spoke to the volunteer team in Betsy and Powys, and they said exactly the same. They had been unable to work with volunteers in community settings simply because the process was so prohibitive, the process of getting them on board. So that has been I would say the strongest output from this research. The toolkit itself is a good basis for starting new community ventures, but you require modifications as would be expected. But it's a great confidence giver because it gives you a framework and somewhere to start, and it kind of gives you some useful information. Two-way learning as well. We didn't expect, and Molly can back me up on this, but we were there to learn from Solva, but we found is Solva also learned from what was going on in Aberporth. And because of all this, I've just added the last one, never anticipate the outcomes of a research project. So our recommendations from it include the main one: statutory sector processes for working with volunteers in the community need to be reviewed and modified. They are not fit for purpose in their current form. More work needs to be done with communities to enable them to become more resilient and meet the growing needs of vulnerable residents. Like I said, that can't be underestimated. Even when you think that a community is active and vibrant, there are still individuals in that community that would benefit for additional support. Cross-sector working and collaboration is crucial in community settings and can be extremely motivational and positive. And I refer to the steering group there. A form of community mentoring should be encouraged akin to town twinning, and I've already stated that. And then there is a need for a research network or a research for community-based interventions. There is very little in terms of when you're developing research projects in community settings, there is very little information or support out there. So one of the recommendations would be to set a community research network up. And we did work with Solva and other bodies to try and put in grant funding to take that forward. It wasn't successful, but I'm sure there are going to be other opportunities to do that. So I just wanted to thank everybody who's been involved in the project. And what I'm going to try and do, I think I've got time to play the short film. What I should mention is that one of the outcomes, one of the outputs, I should say, was that we were to develop a film, because you can tell a story so much better through filming real people. What you can forget, me sitting here and giving you statistics and outcomes and forms, is that we're talking about real people in real communities here. So we did have funding to put towards a film that will chronicle what the work we did and the outcomes. What I have got, it hasn't been completed. We're waiting for the final sign off for the film, but what I have got is a short preview that'll just give you a flavour of the work that we carried on. So hopefully this is going to work and I won't get kicked off. But can you tell me, if you speak, because I won't be able to see the chat box, if there's no sound, can somebody shout out, please? All right. Can everybody see that?
We've got it so far, yes. Anna.
Okay.
My name is Molly Roach. I'm married into Solva. My husband Alan is from here, and we've been living here now since we retired for about 30 years. It was difficult here in Solva to get care, although there are elderly people here, because it is so far to travel. And care firms were saying, we will come if we can do all the cases in Solva. But of course it doesn't work like that. And some people were already with care companies, and some people, because they're retired and have some funding of their own, were having to pay for their care anyway. And so they were getting local people to care for them and local carers. So it was clearly, we thought it's not a situation we can do something about.
As a volunteer, I support Dina, who is the coordinator for Solva Care. We have roughly about 40 volunteers who do various roles, from picking up prescriptions, shopping, picking people up to go to coffee mornings, some interventions at home if they need somebody to come and sit with somebody to do a bit of respite care.
Several communities interested in trying to do it, and they are encouraged by the fact that we are working and it's a success, because I'm interested, as I said, in how different communities react in a different way.
So the Cardi Care project is a new project to the village, which is great because it targets a different type of clientele to the centre. It really enhances the existing projects that we have with regards to the community fridge, the clothing swap, lunch clubs, and other various activities and events we have going on. And it fits in really nicely, as I say, to enhance existing things like the lunch club. People can come out for the whole day and grab some lunch, have some live entertainment, do various activities in a really social, friendly, safe environment.
I think it's just bringing that community together, and it's really this little building has been quite a buzz from day one since we've been here, this last year, and especially after COVID, it's been quite a tonic for people, I think, and there is a need for help, yeah, and it's nice that we've got a lot of volunteers coming our way.
So that's just a taste of the film that we're doing that will have a lot more in it in terms of showing you what was done and how people found the whole project. That's it. Back to you, Jack.
Great. Thanks very much, Anna. So we'll take some questions. There are a couple in the box that I'll ask first while people are thinking of their questions. But there was one question of what was the method of getting in contact with people who weren't known about? Was it the postcards or?
It was the questionnaires. We had addresses, we had people on the ground who were delivering these questionnaires to individual houses and speaking, and that again was led by Solva. I know, Molly, when you said you did your questionnaire, it was very proactive, it wasn't reactive. You had to go out and actually reach out to these people. So yeah, and then there was even somebody who was going around collecting some of the responses if people couldn't leave the house, for example.
Great, thank you. Sarah, you've got your hand up. I can see some now.
Hi guys. Yeah, I'm just interested. It's not a criticism, but just as how we can build on it really. I'm from the frailty team in Halvar, South Ceredigion. I think we probably did at least 8, maybe 9 of the 15 referrals that you received. But the only thing was that nobody had fed back to us. Lakey had said there was delays in getting people through CRB checks, or DBS checks, what are they called now, but nobody had fed back that you only had 2 volunteers on the floor. So of course we've kind of carried on referring, and then of course we're going back to patients' houses for a review after their initial assessment with the frailty team, and we're saying to them, oh, have you heard from Cardi Care? And they're like, no, don't think so, no, haven't heard. I think probably because obviously there's only 2 people who can do active work, but it obviously looks like we've sold a bit of a dud then, do you know what I mean? So perhaps a little bit of feedback, if you'd let us know that, we would have perhaps warned the patients. Or actually it might be a bit of a delay because there's I mean, so frustrated for you that you couldn't get more of the volunteers through the system. I think that's just crazy. That doesn't make sense at all to me.
Yeah, I think I know that the coordinators did contact the people that we had referrals from directly, either through the postcards or by phoning them to explain that there was a delay. So yeah, but I'm not sure you're right, whether they fed back to the source of referral, and maybe that's a loop that needs tying up. I will say that since we've pulled out of since Rural Health and Care, we've pulled out our research element, the volunteers now are following the Aberporth Community Hall volunteer process. They're no longer health board registered volunteers, apart from the 2 that already are. And so the red tape, if you like, or the induction process is much simpler. So they've got a lot more now on board, and the services that they're able to deliver has vastly increased since the end of October, which is a bit, but I'll definitely put you in touch with Nicola. And because of course Lakey left because she came to the end of her fixed term and she's gone on to do a clinical audiology masters. And Nicola took over. I think there might have been a transient period they have handover, but I'll ask Nicola to contact you to give you an update on your referrals. That's a good point. Thank you.
Thanks very much, Sarah. There is another hand up, but I'm ashamed to say I can't see who it is. Anna, can you see who it is?
I can indeed. It's Simon. Simon, do you have a question?
Yeah, thanks. I'm really excited to see this because it fits in very well potentially with the Paris Social Value Forum fund, which hopefully, we're fingers crossed at the moment, we're going to get the fund out again this year. And we've actually got the meeting tomorrow for setting the priorities for the fund within the community, and chances are something very similar as a priority is going to come up. My question is, within any toolkit that's available, is there some indication of annual costing for this? Because obviously with groups forming together to be able to put in a bid, they're going to have to put in a full set of costing, and any help they can get around anticipated costs to be able to put in for a bid would be really, really useful.
If you want to drop me an email, I can give you our costings, and also I know Molly's on here. There is an outline on that of the insurances and the various costings that they've did the standard, but I know, and they employ Lena obviously as a coordinator. That's the main cost. They gave us an indication of costings for our grants, but I can give you ours then, and then vice versa. So if you have you got, well, you'll have my email and I'll send you the slides, and maybe you could just drop me a line and I'll make sure that you get those.
That'd be brilliant. Thank you.
Great, good. Are there any other hands up, Anna? I can't see.
No, but there's a few in the chat.
Yeah, do you want to take the ones in the chat?
So Becky, don't know if you want to speak to it, Becky. You just want to read it. You want to have a conversation? Okay, so I will get in contact with you.
And there was one.
Yes, you can have copies of slides. I will send the slides.
Yeah.
And I don't know if I can send the film because it's quite large, but I might be able to send you a link to it on YouTube.
There's a question about the voluntary council, the county's voluntary council.
Yes, Carvo. Well, Hazel Lloyd Lubran sat on our steering group, was a great support. And in fact, the way that the project moved forward, once we left, they were lucky that Carvo stepped in and gave them some interim funding before some lottery funding that they've acquired over 5 years that will come into play in April this year. So they're funding the interim period, but they were really interesting. And we looked at their they advised and gave help on volunteering processes. And we were all keen to go down a much simpler route, but we were told it was not possible. So the legal people got involved.
We're not going to comment on that. There's another hand up. I think, Sue, you have a question for Anna?
Yes, please. Hi, everyone. So I was just thinking on that volunteering, you said about there being a recommendation to improve it. Is there a minimal that can be done for the volunteers? So things like manual training isn't necessary sometimes. We had a similar issue, and I was just curious whether there's been like a list of they should do A, B, C, but actually the rest can go out the window because it's not required.
Yeah, I mean, we have gone through that. And I mean, at the time, don't forget, COVID had been prevalent, and there was the things like infection control training that they had to do, which really isn't as relevant now. But also they had criteria in place that would prohibit people. There was one gentleman in his 60s who was really keen, but they were scored against COVID risk criteria, and he was told he could not be a volunteer because of his age and because he was male mainly. And then they've lifted those now in the health board. So some things were, of the time, but others, are ongoing. So yeah, there are a lot of training in there that really isn't relevant to, it might be going in and sitting and having a cup of tea with somebody for an hour a week. But anybody who joins a health board as an employee goes through virtually the same process as a consultant in hospital. Okay, they'll have more of the clinical aspects, but the basis are the same. Your staff induction, your employee induction, as when you become a volunteer with the health board.
Yeah. Thank you. I had a similar issue recruiting a couple of volunteers, and did one myself, and then one had to go through the system. Yeah. Thank you.
But I think Sue, to my mind, there'll be a level of different training for different volunteers depending on what roles they want to have in it. I think an element of common sense is required, and I think, to be fair to the health boards, they want to get it right. It's just the legal processes they're working under at the moment need to be sorted out by people on a higher pay grade than either you or I think. Yeah. But I think, variety of training modules for variety of volunteering jobs seems very sensible to me. Great. Can you see any other hands, Anna? I haven't got any more.
No.
No, brilliant. So thanks very much, Anna. And once again, if we'll share contact details, and if you want any more information from Anna, please get in touch with her. And I think at that point we have to go to the assessment of Anna's talk, which Michelle is doing the Mentimeter this time because Anna felt it was inappropriate to do it herself. I think we'd have coped, but anyway, Michelle is going to do it. So can we do the Mentimeter thing, Michelle?
Yeah, I've put the link in the chat again with the code.
Can you turn yourself up a bit, Michelle, or you're a bit faint?
Sorry, can you hear me now?
Well, I can just
Hello.
hear you. I hope
Right.
everybody.
Okay.
That's better.
Right. So yeah, I've put the link in the chat, and it's the same code as before, which is at the top of the screen.
So if everybody could go and score that, that'd be great for our feedback. There we are. Looks like we're pretty much done, Michelle, are we, I think?
Yep.
Great. That's great. Thank you, one and all. And it just falls to me now to thank Joanna and Anna for the presentations, to thank you all for coming. Molly, I should have given you a chance, I think, to say everything that Anna got wrong if you wish to come in about and correct Anna on anything, or just say how anything. Did you want to come in, Molly? I think we might have lost Molly. All I can hear is a lorry. Anyway, I just pass my personal thanks on to Molly and all the Solva Care team, who made it a pleasure and a very worthwhile experience doing this project. Thank you to them. And this is my final job as chairman of Rural Health and Care Wales, which I've done. I've done my 8 years in public service now, so I have to hang my boots up. And I'd like to thank everybody who's been involved with this project from its start. And today, I think, gives us evidence of the worthwhile work we've been involved in. And I just wish that everybody keeps up the good work, and good luck to you all in your day jobs, because I know some of you are having a pretty torrid time. Thank you, one and all, and well, I hopefully see you somewhere soon. Bye, all.
Yeah,
Thank
you
you.
so much,
Thank
Brian.
you, Jack.
Bye-bye.
Bye.
Bye.
Time.